is 10 o'clock on a Friday night. It is the 7th of June. And the good news that I have is that I have a surgery date. hmm I am tentatively scheduled to have a vertical sleeve gastrectomy. That's what they call it. On the 1st of August. So I'm trying not to get too excited because I know that it's a tentative date, and so it hasn't really occurred to me yet that it's happening. They tell me it's a tentative date because pending, insurance approval. I've done everything that my insurance requires. I don't see there to be any reason as to why I would be denied. My insurance didn't require any specific amount of weight loss to be approved, or any medically supervised weight loss or anything like that. So cross fingers. Doing everything the doctor tells me to do. So on the 2nd of July, I have a meeting with the pulmonologist. I'm assuming we're going to talk about my CPAP machine and how I'm feeling, which that's going great. I use it every night. After that, I'm going to have a pre-surgery consult with my surgeon. That's where I'm going to sign all the consents, and he's going to let me know all the risks of the surgery and, their expectations of me for the liquid diet and all that jazz. So I'm excited about that. I want to see if I can get a tour of the type of hospital room that I'm going to be staying in. And I don't want to sound like a snob. This is going to sound snobby. Whatever. The hospital that I go to recently had a new addition put onto it. And the rooms in the new edition of the hospital are very nice. The rooms in the older edition of the hospital, not so nice. So I'm really hoping that I get one of the nicer new rooms by myself. Let's hope so. So yeah, I would honestly just like to have a tour of the room, see what the bathroom's like, what the shower situation is like, what the outlet situation, like how long of a cord do I need to have? And granted, I know that's not the top of my list, but anything that I can have less anxiety about will make me feel better, make me feel more relaxed. I know they're going to want me to be walking around after surgery. So, I want to see what the floor looks like. How far am I supposed to be expected to walk? There's so many things that I want to know that I guess in retrospect aren't really that important, but it just helps to ease my mind. So at least if I can visualize exactly where I'm going to be at and the things I'm going to be doing, where I'm going to be doing them, it gives me less anxiety. I know it really doesn't matter, but maybe that's just a control thing I have. I need to know that I'm going to be comfortable. I don't want any surprises. If I'm not going to be comfortable, I want to know in advance. Um, but that's pretty much it. You know, I think most hospital websites say that you can have a tour, but I don't know if they really sincerely mean that. So um, that's something I'm going to want to talk to my doctor about, my surgeon. I want to see what my room's going to look like. He goes, how am I going to sleep? Like, how am I going to sleep in a hospital room and I'm not comfortable? Like, I know drugs are a powerful thing, but it would ease my anxiety a lot if I could just know in advance exactly what it looked like. Am I ridiculous? Let me know. Um, I've been watching a lot of those what to bring to the hospital videos, and I feel like a lot of the information I'm seeing is just not remotely factual. Like, you can't bring electronic appliances, you can't bring heating pads, you can't bring medications like gas X strips. You can't bring that stuff. um, so let me know if there's something that you brought to the hospital that really helped you out, um, but that's like allowed in the hospital. Okay. Um, so we're here. I'm excited. I feel like I should be more nervous, but I'm excited. Maybe I'm naive. I'm still excited.